Communication skills are central to all medical consultations. Family physicians are often acknowledged to be masters in communication as we obtain a lot of information from our patients. There are different methods to enhance communication, but the family physicians have chosen to adopt the patient-centered clinical method because of its proven outcomes. In this kind of method, or this method has clear steps for the doctor-patient interview. And this can be assessed when you listen to the interview carefully. So this communication skills observation tool helps to capture these steps in their natural sequence. The patient-centered clinical method is not the only method that is captured in the communication skills observation tool. There are motivational interviewing skills that can be captured, as well as skills in breaking bad news using the SPIKES algorithm. When we look at the top of the form, the method in which a particular point or a particular signpost is assessed is to give a score of 2 if the resident doctor is able to show this skill as at the level of performance that you would expect of a family physician. The resident doctor can also get a score of 1 if they showed it partially or you're not sure that they showed it. And they get a score of 0 if it was not shown at all. So rather than mark down a resident doctor because you're not sure if you paid attention or if you caught something, if you're not sure about it, then give a score of 1. But if you're sure that they didn't show it, then give a score of 0. And if they showed it at the level and the competence of a family physician, then you give them a score of 2. So this is what the assessment form looks like. It's over 3 pages, but because it's really small, we're going to look at it more closely. So let's look at each section of the tool now. So this is page 1 with the title of the form. And when we look closely, we've already described how to give a score. We look at the first part, which is initiating the session. And there are 2 sections here, which is, number 1 is makes appropriate greeting, introduction, and demonstrates interest and respect. So these are kind of similar to what we have in the scoring sheets when we're having an OSCE station. I'll give you a little time to read how this particular step is described. You have 2. Number 2 is identifies and confirms the patient's problem list or issues. So an opportunity to make their presenting complaint spontaneously, or maybe exploring the initial problem. So like, okay, you have a headache, fever. Is there anything else you'd like to talk about? So very often using open-ended questions and then summarizing to be able to confirm the list from the patient. The next section is about gathering information, and there are 4 points here. So the first is encourages the patient's contribution or story. I'll give you a few seconds to read what is under there. Now, something that is important is about recognizing cues. So little things that the patient contributes that seem to be a little bit outside of the presenting complaint, they're usually signs that the patient, subconsciously likes that issue to be explored. So does the resident doctor demonstrate that skill? Number 4 is makes an attempt to understand the patient's perspective. So here we are exploring the patient's illness experience. So the beliefs, the concerns, the expectations, and the feelings. Number 5, we're thinking family and obtains relevant family, social, and occupational information. So here, definitely the tools to be able to obtain that information can be assessed here. the process of obtaining that information. And number 6, or the fourth one in this section, is obtain sufficient information to ensure no serious condition is likely to be missed. So is the clinical information thorough? Is there a systematic review? Page 2, and like we did in page 1, we're going to go close and look at each item. So the next section is about explanation and planning. Here, the questions will take us to number 12, but I can't show the whole page in this view. So let's start with number 7. So it appears to make a clinically appropriate working diagnosis. So are we happy with how the person collected all that information and came up with a diagnosis that is logical and is based on objective evidence? Number 8 is that there is a clear explanation of the diagnosis and management plan. So patient-centered clinical method expects the doctor to be able to explain to the patient what is going on in a language that they can understand without using medical jargon. 9 says gives a patient an opportunity to ask for other information or seeks to confirm the patient's understanding. So, direct questions like, are you clear about this? At times even asking them to give a recap to be sure they've understood. Those are the skills we want to see. Number 10 says the explanation takes account of and relates to the patient's perspective. So connecting the diagnosis with the illness experience that was obtained, showing skills of empathy, being able to the doctor will be able to understand and appreciate what the patient is going through. Number 11 says involves the patient where appropriate in decision making. So giving more information about, the investigations, finding out if the patient is fine with it, if there are different treatment options, giving the patient the opportunity to decide on a particular one, understanding why they've chosen it, and maybe guiding them if the choice is not the right one. But having the patient being involved in decision making. And the last one in this section is choose an appropriate management plan. So plan that is based on scientific evidence. We can't be swayed by being patient-centered. We have to do right by the patient scientifically, but put the consideration of the patient's perspective to be able to give a better outcome. Then comes to the closure of the interview. So point 13 says closes consultation successfully in the time available. So is the doctor able to be time conscious? Many young doctors, when we talk about PCCM, feel that it's a very nice method, but it takes too long. They assume it must take 30 minutes. Is this consultation over in about 10 to 15 minutes? The WHO standard for a general practice consultation is 10 minutes. But many of us, because we're working in a teaching hospital setting and we're doing training, we know consultations can be 20 to 30 minutes. If it's longer than that, then there is something wrong. The doctor needs to improve on their skills. 14 says provides appropriate safety netting for the patient. So a way that the person can contact them, or a service if there is an emergency where they can go to, or if they need to see the doctor before the next appointment, how they can approach that, or if there are complications or they need to get more information about a problem where they can seek. So this is a skill that we want the resident doctor to show. And the last page, 15, allows if the resident doctor has an opportunity of having this. So it's not automatic. Any of these skills here could, give that 15th point. So let's look at it more closely. So it could be establishes therapeutic rapport, relationship in the patient with mental or psychosocial problems, So if things are complicated and there is a lot of needing to, active listening, summarizing, facilitating responses, all these things, showing empathy because of how complicated the patient is, the person is able to do that, and you can give them a score in this section. Or the person uses the breaking bad news skills, the spikes that we talked about. If they did it well, then they can get it too. And lastly, if you have a patient that is in the pre-contemplation stage and you want to get them to be contemplating a behavior change, then motivational interviewing skills are usually what one would want to use. So is this person able to demonstrate it? So there are these methods, signposts in motivational interviewing, like elicit, provide, elicit, brainstorming, roles with resistance, all these terminologies that are used in motivational interviewing. Are you able to identify that the resident doctor is using all of this? So there is a total score of 30. Remember, there were 15 sections. And once you have that score over 30, then you divide it by 3 to convert it to a score of over 10.
Good afternoon, Mrs. Adeyemi. My name is Dr. Lawal. Dr. Senjabi has asked me to see you today because he's going for a course. And before he left, he mentioned to me that you have a neck swelling and that you'll come for follow-up today so that we can discuss your results. Do you have any other thing that you want to talk about?
No, not really. I'd already discussed with Dr. Shenjobi that I've had this neck swelling and it's really disturbing me because I have to wear a scarf. I'm a newscaster and I have to literally cover it up, and I want it taken care of as soon as possible.
Okay, I understand that. Just briefly before we go into the discussing your result proper that you have come for today, can I ask what your source of salt intake is for the family?
I'm really wondering why you're asking that question.
Okay, I'm asking because a deficiency in iodine has actually been linked to similar swellings like this in patients. So usually we like to know the source of patient salt intake.
Oh, okay. Well, now that you've mentioned, I buy my salt from the open market, but sometimes I go to the supermarket and look through the sachet of salt and see some that say iodized, but I don't do that all the time, really. Most of the time, the salt we take is from the open market.
All right. Okay, I get that. Is there any other thing that you want us to talk about before we move into discussing your results?
No, I'm just really curious as to what the results is about.
Okay, so from the interaction that we've had and what Dr. Sindobi has discussed with me,
okay,
it seemed like you have an thyroid goiter. Okay, so by thyroid goiter,
okay,
I mean that the thyroid disease is not hyperfunctioning or is not overactive or underactive. Do you know what the thyroid gland is?
Well, yes, Dr. Shenchobi mentioned the fact that the thyroid gland is the butterfly gland in the front of my neck.
Okay.
Okay.
Okay, so the thyroid gland usually produces some hormone. Okay. So the thyroid function test is a test that we do in order to check the levels of this hormone. Okay, so usually there are 3 parameters that we checked. We check the TSH, we check the FT3, and we check the FT4. Okay, so do you understand what I mean by the TSH, the FT3, and the FT4?
No,
just the hormones that I have discussed before.
I did look at the result and I saw T3, T4. I really don't know what it means, and I'm not sure what hormones mean either. So
okay, so hormones are just chemical messengers in the body.
Okay.
And the thyroid gland produces this hormone.
Oh, okay.
Okay, so can I discuss the results now?
Yes, please.
Okay, so your T3, T4, and CSH are essentially normal.
Okay.
Which means that the thyroid gland is not overactive or underactive.
Okay, so that means I'm fine?
Technically, yes. However, because you have concern that you don't like the gland being there,
no, I don't.
It has caused you to wear scarf most of the time on your neck. and the fact that over time it could get bigger. So on account of that, I might have to refer you to the general surgeon for an operation.
An operation? Is that the only way I can get rid of it?
Not necessarily. It could be treated with drugs. In your own case, because being there for a very long time, it could actually get bigger. It could affect your work, as you have pointed out. So in your own case, you may need to remove it. And after it is removed, you may have to be taking a tablet every day in order to replace the hormone.
Okay, so now you've mentioned that I'm going to have to remove it. Would there be a scar? Because I'm worried about that too.
Yes, there will be a scar. However, I want to say that in my years of practice, most patients I've seen have an extremely minimal scar. However,
that's encouraging.
However, some patients can develop thickened and prominent scar.
So what will you do if I develop a thickened scar?
So what you do is you help us monitor it after discharge. When you notice a nodule or a scar developing around the operation site, you can present so that we'll manage it appropriately.
So you're telling me that if I have a scar, there can be treatment for that as well?
Yes, they can.
Well, you also mentioned that I'm going to be using a tablet.
Yes.
I'm going to be using that for life?
Yes.
Well, at least the swelling will be gone. I just have to use a tablet.
The swelling will be gone. You'll be able to keep up with your activity.
I think I can manage
So
that.
do I have a permission to refer you to the general surgeon now?
Yes, you do.
So let me quickly say that after the operation, it is expected that you'll be coming for follow-up with the general surgeon. They'll be checking the levels of your hormone, and they'll also give you that drug. However, as a family physician, I also co-manage with them, and I'm going to be here anytime you need me.
That's beautiful.
In case you have any symptom before your appointed time with the general surgeon.
All right, that's good. I'm really happy to hear that. I want to quickly look through my list. I had a couple of questions, and I think you've addressed all of them. Thank you very much.
So if there's any other complaint, you can let me know.
Thank you. Thank you, Doctor.
I hope you had fun watching that video. For question 1, I gave a score of 1. What did you give? For question 2, I gave a score of 2. I thought it was well demonstrated. You don't have to answer on the chat now. We're going to talk about it later. But let's just see whether my assessment and your assessment tallies. For question 3, I gave it 2 as well. For question 4, I gave it 2. For question 5, Things Family, obtains relevant family and social and occupational information, I gave it 2. Question 6, obtains sufficient information to ensure no serious condition is likely to be missed. I think it wasn't really very pertinent here since it was sharing a diagnosis, but I think a little effort was made about this. I gave it 1. For 7, appears to make a clinically appropriate working diagnosis. I think it was very clear. I gave her a 2. For question 8, there's a clear explanation of diagnosis and management plan. I give her a 2. Question 9 gives patient an opportunity to ask for other information or seeks to confirm patient's understanding. I gave it 1. I felt she was a little bit like she wanted to get on with her business, but I suppose in the reality of the clinical interaction, we don't have all the time in the world, but I chose to give her a 1. I don't know about you. For question 10, the explanation takes account of and relates to the patient's perspective. I think I gave her a 2. She brought in that idea about her concern of the scar, her concern of the swelling on the anterior neck, and why she needed to have the surgery. So I think she related that very well. For question 11, involves the patient where appropriate decision is making. in decision making. Sorry, I think she did. Although this patient was very forthright and sure of herself and took a lot of initiative, but the doctor went along with what the patient wanted and helped the patient to make these decisions, walked along with her. So I gave her a 2. For question 12, choosing an appropriate management plan, I gave her a 2. She used scientific evidence that if the goiter had been there for a long time, it was not likely to go spontaneously with medicine, so that surgery was the better way, plus the fact that it was going to help her with her cosmetic request. For question 13, closes the consultation successfully in the time available. I mean, the whole video took about 6 minutes. That's not bad, even though, of course, it's not the whole clerking. It's just discussing results. But she concluded properly, so I gave her a 2. Question 14, provide an appropriate safety net. I think that was demonstrated, telling her about where she can go if there was any problem, and that she was there, even though with Dr. Shenjobi, who is her primary doctor. For 15, there was no need for additional skills. So I gave her a 0. It was not done. It was not shown. Same thing for breaking bad news. It was not shown. And motivational interviewing, it was not shown. So please note that these 3 areas are just give you 1 score. Okay, so it's not likely that a patient will need all 3 of these skills to be shown, but it could happen. So the total I gave was 25, and divided by 3, it came to approximately 8. Thank you for your great participation, and I look forward to all your questions.